Welcome to the deep dive. Let's get straight to it today. Mydriasis. So what exactly is it? Well, simply put, it's when your pupils become large, dilated, and don't really react properly to light.
Exactly. It's not a disease in itself, more of a clinical sign.
Right, a sign that something else might be going on. Could be an underlying condition, or maybe even side effects from, medications.
Precisely. And our mission today is really to give you a clear, high-yield overview of this sign, cover the essentials you need to know.
Okay, so just to reiterate the definition,
Yeah.
we're talking enlarged non-reactive pupils.
That's the core of it. Seeing that should definitely trigger further investigation.
So what kind of things cause this? What's the etiology here?
Well, the causes are quite varied. Sometimes a mnemonic can help. I've heard MAD nurses take some substances used.
Okay, how does that work?
So MAD could stand for medications. Big culprits are anticholinergics, things like certain antidepressants, or even eye drops like tropicamide, atropine. Also sympathomimetics like amphetamines, cocaine.
Right, medications. What about nurses?
Nurses for neurological conditions. Think Horner's syndrome, 80s pupil, maybe a third nerve palsy.
Got it. Take.
Take for trauma. A direct injury to the eye can cause it.
Makes sense. Some.
Some for systemic diseases. Diabetes is one example.
And substances.
Yeah, substances overlaps a bit with medications, but covers recreational drugs like cocaine or amphetamines again.
Right.
We also see it in specific things like Holmes-Adie pupil, traumatic ear diplegia, even pheochromocytoma sometimes, or it can be congenital.
Okay, that's quite a list. It's worth noting, too, sometimes anisocoria, just unequal pupil sizes, can get confused with this, right?
Absolutely. Mydriasis usually implies both pupils are large and poorly reactive, though it can be unilateral. Anisocoria is just the size difference.
A good distinction. So thinking about who's more likely to get mydriasis, what are the key risk factors?
Well, the main ones really linked back to the causes. So definitely current use of those medications we mentioned.
Okay.
Also, a past history of eye trauma or eye surgery, and having pre-existing neurological conditions or those underlying systemic diseases like diabetes.
So fundamentally, what's going wrong? What's the pathophysiology?
Basically, it comes down to the muscles controlling the pupil size in the iris. You've got the sphincter muscle that constricts the pupil, and the dilator muscle that widens it. Mydriasis happens when there's a problem affecting these muscles, or more often the nerves that control them. So disruptions in nerve pathways, or maybe imbalances in the neurotransmitters involved.
Okay, so if you see this sign, what else should be on your mind? The differential diagnosis, maybe that far-motor sympathy system idea helps here.
Yeah, that's a decent framework. First off, rule out pharmacological causes, always check the meds.
Fabulous.
Then think about oculomotor nerve issues, motor, so a third nerve palsy. Then sympathetic nerve problems, sympathy, like Horner's, although that typically causes meiosis, a small pupil, but issues in the sympathetic pathway can be complex. And finally, other ocular or systemic diseases system.
And how common is this overall, say, in the UK?
Specific figures for mydriasis itself are tricky. Because it's a sign in other things, the epidemiology data really focuses on the prevalence of those underlying causes.
Right, that makes sense. So clinically, what are we looking for? The key features. We said big, no reaction.
Exactly that. The hallmark signs are one or both pupils being noticeably enlarged and, crucially, having a reduced or even absent response when you shine a light on them.
And other symptoms might crop up depending on the cause.
Definitely. Depending on what's actually causing the mydriasis, the person might also report things like blurred vision, maybe eye pain, double vision, or other neurological signs like a droopy eyelid.
So, investigations.
Yeah.
How do you approach working this up?
The absolute crucial first step is a really good medical history. You need to know about all medications, including over-the-counter drops or patches, any past medical history, especially neurological issues or trauma.
Yeah, history is key.
Then a thorough physical exam, focusing obviously on the eye exam, carefully assessing those pupillary light reflexes, checking eye movements, visual acuity.
And then maybe further tests.
Yes, but they're guided by what you suspect. If you're thinking neurological, you might need imaging, like an MRI or CT scan. If it's maybe systemic, a blood test might be relevant. It's tailored.
Okay. And management, what's the plan?
It's entirely focused on finding and treating the underlying cause. There isn't a treatment for mydriasis itself. You treat the condition or stop the medication that's responsible.
So no magic bullet for the symptom. You have to fix the root problem.
Precisely. And that's why getting proper medical advice and diagnosis is so important. You need to know why it's happening to manage it correctly.
What about the outlook? The prognosis.
Highly variable. It really, really depends on the underlying cause. If it's caused by eye drops, it'll likely resolve when they're stopped. If it's due to significant nerve damage or a chronic condition, the mydriasis might be long-term, and the prognosis relates to that condition.
And any potential complications to be aware of.
Again, linked to the cause. But the dilated pupil itself can cause sensitivity to light, photophobia, and blurred vision impacting function. More serious complications relate to the underlying pathology, whatever caused the mydriasis in the first place.
So early diagnosis and management are pretty key then.
Absolutely, to minimize any complications and improve the overall outcome.
Great overview. So the main takeaway, mydriasis is a sign, a clue. You need a systematic approach to figure out the why behind it.
Exactly. And it leads to a kind of interesting thought, doesn't it?
Oh.
Considering how many common everyday medications can actually affect pupil size, you have to wonder, what subtle clues might we sometimes be overlooking in just routine assessments?
That's a really good point. Definitely something to think about.
Mm-hmm.
Well, for more detailed revision resources and practice questions, remember to check out PassTheMSRA.com and also FreeMSRA.com. Thanks for joining us for this deep dive.